So today we are going to discuss autoimmunity and what is autoimmune diseases. Hence, last but not the least, in autoimmune anemia, the red cells are coated with antibodies are prematurely destroyed in the spleen and the liver, and hence resulting in autoimmune anemia. Rarely complement dependent intravascular hemolysis also appear. In autoimmune anemias, there are serologically two groups of autoimmune anemias, which are characterized by cold and warm antibodies. In cold autoantibodies, complete agglutinating antibodies of IgM class is there. They agglutinate the erythrocytes at 4 degrees centigrade but not at 37 degrees centigrade, which is seen in syphilitic infection, primary atypical pneumonia, trypanosomiasis, and black water fever. Whereas the warm autoantibodies, these are incomplete, non-agglutinating, and are usually IgG class. And the person taking drugs, for example, sulfonamides, antibiotics, and alpha-methyl dopa, they usually have these warm antibodies and resulting in autoimmune anemias. Now we'll talk about idiopathic thrombocytopenic purpura. So there is a self-antigen which is present on the platelet membrane proteins, and hence the immune response is developed by development of autoantibodies against platelet membrane antigens, leading to the decreased platelet count, resulting in thrombocytopenic purpura. So autoimmune reproductive diseases, in this we were talking about organ specific, so orchitis. In this, the immune response develop with anti-sperm autoantibodies. There is a development of anti-sperm antibodies resulting in an autoimmune reproductive disease, and autoantibodies to hormones are also seen, and they develop against progesterone, estrogen, luteinizing hormone, gonadotropin releasing hormone. So, some of the examples of organ-specific autoimmune diseases, in just a brief view, I'm going to give it to you all. For example, in the disease like multiple sclerosis, the main organ affected is the central nervous system, and the proposed self-antigen is the myelin basic protein, myelin oligodendrocyte protein. So the clinical presentation of the patient is loss of vision, there is a weakness of limbs, sensory abnormalities, and incontinence. So this is the antigens. These are the antigens for which the autoantibodies are present in our body. And in Graves' disease, the main organ affected is the thyroid, and the proposed self-antigen is present in the thyrotropin receptor, and which results in hyperthyroidism, weight loss, nervousness, palpitation, diarrhea, and exophthalmos. Whereas in Hashimoto thyroiditis, the main organ involved is thyroid, and the proposed self-antigen is thyroperoxidase, thyroglobulin, which results in hypothyroidism, weight gain, constipation, skin changes, myxedematus, dementia in the concerned patient. In good pasture syndromes, the main organ affected is the lung, kidney, and the proposed self-antigen is present in the glomerular basement membrane. The clinical presentation, the patient presents with kidney and respiratory insufficiency. In pernicious anemia, we have already told about this thing, that there is an vitamin B12 malabsorption, and there is an intrinsic factor, there is an autoantibodies against the intrinsic factor, so which results in ultimately anemia and gastritis. In Crohn's disease, the main organ affected is the intestine, and there are 7 microbial antigen which is involved, and which results in hemorrhagic diarrhea, abdominal pain, which is the clinical presentation in the patient. The other diseases are type 1 diabetes mellitus, main organ infected is pancreas, and the proposed self-antigen is islet cells, insulin, glutamic acid decarboxylase, and in which the autoantibodies are developed, resulting in polyphagia, polydipsia, polyuria, and weight loss in the patient. Immune thrombocytopenia, I have already told that their proposed self-antigens are the antigens are present as the glycoproteins on the surface of the platelets against which the autoantibodies are developed, resulting in decreased in the platelet count, and hence easy bruising and hemorrhage is the clinical presentation or the classical presentation of the patient. Now the myasthenia gravis, the main organ affected is the muscle and the proposed self-antigen being the acetylcholine receptors, resulting in muscle weakness and fatigability in the patient. Next is the hemolytic anemia. The main organ affected is the red cells and resulting in the clinical presentation of anemia. Now is the systemic autoimmune diseases. The first example is the Sjögren's syndromes, in which the main organ affected is the salivary and the lacrimal glands, and the proposed self-antigen being the nuclear antigens. There is a classical clinical presentation is dry eyes, dry mouth, lungs, and kidney disease. The second is the rheumatoid arthritis, in which the main organs are joints, lungs, and nerves, and their proposed self-antigen is the citrullinated peptide in joints, which are IgG, and the autoantibodies basically is anti-citrullinated antibodies, which are basically against the citrullinated peptides in the joints and are of IgG types and resulting in the deforming arthritis. Skin nodules, occasional lung and nerve involvement can also be seen. Now is the SLE. In this, the main organ affected is kidney, joint, skin, and CNS. There is a CNS involvement. Proposed self-antigens are the DNA, histones, and the ribonucleoproteins, resulting in arthritis, skin rash, kidney insufficiency, and nerve damage in the patient. Last but not the least, it's the Wegener's granulomatosis. The main organ affected is the lung and the kidney, and there are the autoantibodies which develop against proteinase 3, resulting in sinusitis, shortness of breath, and the kidney failure. So basically the treatment of autoimmune diseases include the two type of tests. First is the general tests and the second is the specific tests. In general tests, we detect the elevated serum GABA globulin levels, the presence of immune complexes in the serum or deposited in the tissues, depressed level of serum complement, and presence of various autoantibodies. I'll repeat, so these are the general tests. Now we are talking about the specific test. Specific tests help us to detect the antibodies in response to a particular antigen involved in a disease. For example, in SLE, we can detect anti-nuclear antibodies. In rheumatoid arthritis, we can detect rheumatoid RA factor in and anticyclic citrullinated peptide, that is anti-CCP antibodies we can detect, whereas in immune idiopathic thrombocytopenic purpura we can detect the antiplatelet antibodies. As far as the treatment is concerned, there is an available treatment thus far in non-specific, that is azathioprine or corticosteroid gold salts, which can be used for the early course of the disease in rheumatoid arthritis to subside the inflammation or non-specific inflammation. The aspirin or the steroidal and non-steroidal anti-inflammatory drugs, that is NSAIDs, can be used. More of the experimental approaches have come forward for the treatment of the autoimmune diseases, which include bone marrow transplantation, stem cell therapy, intravenous immunoglobulin therapy. There is anti-CD4 B cells or anti-interleukin 2 receptor antibodies which can be given, and antigen-based immunotherapy can also be given to the patients to cure the autoimmune diseases. But since depending upon the chronicity, it should be kept in mind that these autoimmune diseases are not reversible. Thank you.